The CDC is now strongly recommending people who are pregnant and breastfeeding to get a vaccine. Now, that's a shift from the agency's previous neutral guidance advising that pregnant women were eligible for the shot but should consult a physician first. The move comes amid data that the shots do not increase the chance of miscarriage and the risk of severe illness from coronavirus while pregnant could be very serious. And a source tells CBS News the FDA is expected to authorize a booster shot today for people with compromised immune systems for whom 2 doses may not be enough. And this all comes as the latest CDC data shows the U.S. is averaging more than 113,000 new infections a day. That's a more than 400% increase over the last month. Joining us now to discuss this and more is immunotherapy specialist, Dr. Leo Nissola. Doctor, thanks so much for being with us. Let's first talk about the new vaccine recommendation for pregnant people. Can you break down some of the CDC's findings that led to the update? And do you agree with it?
Absolutely. New research shows that the vaccines in pregnant women not only are safe, but they're also effective into preventing severe disease. More than ever, we need folks to be immunized around our communities. And I think pregnant individuals have been struggling for the past year without knowing exactly what to do. And this new guidance from the CDC pushes forward a stronger message as far as safety and efficacy of the currently available vaccines in the U.S. for pregnant women. So I'm very happy to see the CDC taking this leadership role into guiding policies around pregnant individuals.
And so now we're hearing that the FDA is expected to announce today that it's authorizing a 3rd dose of either Pfizer or Moderna, the vaccine, for people who have compromised immune systems. Vlad and I talked about this a couple weeks ago. We had a gathering with a bunch of people outdoors, and one person had an underlying condition. So she had been vaccinated very early on. She was able to get access to the vaccine in January, and then shortly after that gathering, she tested positive for COVID. And she was very sick for a while. So, clearly this is just my personal experience, but obviously I'm not the only one that feels that this might be necessary for people who have particularly sensitive immune systems.
Yeah, well, I think, countries like Israel, Germany, they have moved forward with an approach of 3 doses for the mRNA-based vaccines in many patient populations. I think the U.S. is following the same pattern as new data comes in. I think the agency is working with the drug developers to understand if the studies that they're conducting with real-world data of individuals that have been immunized in our communities have any benefit from receiving a 3rd shot. And so far, what we know for sure is that there is clinical signals of wanting immunity in some parts of the population. What we don't know for sure, it's exactly which part of the population that is. When we mention immune systems being compromised, I'd like to understand a little bit further into which variables they're using or which baseline clinical features they're using to make those assumptions of immune function.
So, Doctor, you're based in San Francisco, a city with a very high vaccination rate, but there has been a recent surge in COVID cases there, which has led to a shortage of tests. Explain what's driving the increase, and are you seeing any serious illness among the infected?
Yeah, so San Francisco has done extremely well since the beginning of the pandemic into controlling and curbing the spread of the coronavirus. But also, over 70% of the population here has been fully vaccinated, which is great. However, San Francisco also has some vulnerable populations and some hesitancy into receiving the shots, although the mayor here made them available for everyone that wants them. So in that sense, I'm seeing more cases in being reported around unvaccinated individuals. Another important point here, Vlad, also is to understand that new cases do not necessarily mean new illnesses. Testing positive for the virus can mean many things. But for the vaccinated, it means that your chance of not developing any symptom at all is it's very high. So in the sense, I'm not concerned at all with the numbers here in San Francisco.
Speaking of the state, anyways, of California, it's the first state to require that all teachers and staff in both public and private schools be vaccinated against COVID, or they'll have to face weekly tests. The state's largest teachers union is on board with this decision. I imagine that you support it as well.
Absolutely. And you see, I think we've talked about this for the past 18 months quite a bit. I think we're struggling with vaccine equity, and we are struggling because some folks here are hesitant to receive the vaccine. Now, I talk to people from all around the world every day, including teachers that live in South America, teachers that live in Europe. And everyone is begging for access to a life-saving vaccine in the middle of a global pandemic that we still have to fully control. In that sense, for me, I'm not a fan of mandates at all, have never been. But it's a little bit complicated talking about refusal of a vaccine without any medical condition to do so. In that sense, yes, I agree that we should vaccinate individuals by mandating in case they are not fully on board on getting the vaccines if they're going to work in the public sector. So I support the decision there.
The European Medicines Agency is also looking into 3 new side effects that were found in a small number of people after getting the mRNA COVID vaccines. Can you explain what these side effects are and just who they're showing up in?
Yeah, so just making sure that folks understand, side effects and adverse events occur in all drugs, whether they are over-the-counter or prescription drugs, and vaccines are like the same way. What's important in that story is that agencies are monitoring the adverse events and the side effects. What happens is the immune system is a tricky commodity. It is sort of a training school for your immune system. You deliver a message through the vaccines to prevent disease and to prevent death. What happens sometimes is that your own cells interact with the drug in case and create this exacerbated immune response that can lead to allergies like the skin rash. I just read the report on that specific case reported by Reuters. Now, for me, it's interesting to see that the neutralizing antibodies are still holding the immune protection, even though some individuals might experience a small side effect.
All right, Dr. Leo Nissola, thank you so much.
Thanks for having me.
Later today, the White